My name is Reina Bedran, and I will be presenting Improving Morning Hospital Discharges in an Inpatient Internal Medicine Service. University Health System Consortium described 50% of hospital discharges in the morning as clinical best practice. Many studies highlight the positive effect of early hospital discharge on various aspects of patient safety and quality of care. In our literature review, we found that there were many benefits of early hospital discharge. It allows for reduced boarding time in the emergency department and timely transfer of patients to the inpatient medical floors. This prevents overcrowding of the ED, and it allows for timely admission to floors where the proper staff for the level of care needed can be found. It also allows for reduced length of stay. Timely transfer of the patients from the ED to the medical floors allows for better utilization of admission day in terms of diagnostic and therapeutic management. It decreases the risk of hospital-acquired infections, and it reduces unnecessary prolonged immobilization, therefore improving time to recovery. It also allows for improved quality of care. It improves interpersonal relationships between patient and staff due to decreased stress in sorting out the causes of delay of discharge. It allows patients to address all of their questions and concerns with their physician prior to discharge while the physician will still be in-house, and it overall improves patient satisfaction. Unfortunately, there are many barriers to early hospital discharge, one of the main ones being late discharge order placement by physicians. And we found that the problem at our institution was that discharge orders are more frequently placed by physicians after noon. So the aim of our study was to decrease the number of hospital discharges after noon by 50%. In PDSA Cycle 1, the Information Technology Department provided hospital-wide data regarding the number of discharge orders placed prior to noon for inpatients on the internal medicine teaching service in June 2018. And then using root cause analysis, we identified that the discharge of medically stable patients was often delayed because of lack of awareness among physicians about the benefits of timely discharge and lack of appropriate planning for the upcoming discharge ahead of time. So we provided a mandatory educational session in January 2019 for resident physicians on this inpatient IM teaching service. Physicians were provided helpful tips during this educational session for achieving earlier hospital discharge. For example, having discussions with consultants and case managers one day prior to expected discharge for efficient disposition the following morning, and prioritizing patients with expected discharge during morning rounds with their attending physicians directly after caring for unstable patients, of course. After the educational session was conducted, hospital-wide data was obtained from IT for January and February 2019 regarding the number of discharge orders placed prior to noon for inpatients on this service. Of the total number of discharges, 16% of patients were discharged before noon in June 2018. After the educational session was conducted in January, this number improved only slightly to 17.33% for January and February 2019. There was little improvement, 1.33%, in the percentage of discharges prior to noon among an inpatient IM teaching service after the educational session to the resident physicians. And this is a graph representing our data. So we planned on incorporating the educational session into the mandatory monthly floor orientation for resident physicians to provide frequent reminders regarding the benefits of early hospital discharge. And in PDSA Cycle 2, this is exactly what we did. As planned, the educational session was incorporated into the monthly floor orientation that was mandatory for resident physicians to provide frequent reminders, starting from the end of PDSA Cycle 1, which was March 2019. And then hospital-wide data was obtained from IT for October to December 2019 regarding the number of discharge orders placed prior to noon for inpatients on this service. Of the total number of discharges, 59.87% of patients were discharged prior to noon in October to December 2019. This is a significantly higher percentage in comparison to our PDSA Cycle 1 result, which was 17.33%. And this is a graph representing our data. So we plan on continuing to provide the educational session during the mandatory monthly floor orientation, and we also plan on expanding the educational session to the attending physicians as well. In conclusion, there was significant improvement, 42.54%, in the percentage of discharges prior to noon among an inpatient IM teaching service after incorporating educational materials into mandatory monthly floor orientation sessions, providing frequent reminders to resident physicians. We plan to continue with these sessions and expand them to attending physicians in hopes of reducing the number of late hospital discharges even further in our next PDSA cycle. Here are our references. Thank you very much.